In the study we present this year at ASCO, we study a cohort of over 2,000 patients with early-stage hormone receptor-positive HER2 negative breast cancer, and we found that patients with germline BRCA1, BRCA2 have a reduced long-term outcome compared to the wild-type population. These findings were studied in a cohort with a follow-up of over 20 years, and we clearly showed that the population, especially patients with germline BRCA2 tumors, have a reduced long-term outcome with an increased risk of distant relapse. These findings were also validated in a separate cohort. The main finding that this population may have an increased risk of relapse pose a unique challenge for the current treatment landscape for early-stage hormone receptor-positive HER2 negative breast cancer. Indeed, in a subset analysis of this population, we found that only 20% of these patients are currently eligible to adjuvant olaparib treatment, meaning that among 80% of the patients cannot receive a targeted therapy despite this increased risk of relapse. This underlined the need for new clinical trial testing addiction of PARP inhibitors or novel DDR agents as adjuvant treatment in these patients with an increased risk of distant relapse. Now we are expanding this work, and we are also conducting some translational analysis on this patient population, meaning that we want to study better the profile of homologous recombination deficiency, including genomic analysis, transcriptome analysis, and also functional studies for this pathway. These correlative studies may somehow underline and refine these findings that we have in the clinical analysis, and also we will try to identify the patients that may have more benefit for an escalation of adjuvant therapy.